Hello. For the record, my name is Erin Murphy, at-large City Councilor. I am the chair of the Boston City Council Committee on Public Health, Homelessness, and Recovery. I am joined by my colleagues today in order of arrival, Councilor Tanya Fernandez-Anderson, Councilor Flaherty, Councilor Baker, Councilor Durkin, Council President Flynn, and Councilor at-large Ruthie Lujan. This public hearing is being recorded. It is being live streamed at boston.gov/city-council-TV and broadcast on Xfinity Channel 8, RCN Channel 82, FiOS Channel 964. We will be taking public testimonies at this hearing. If you are here with us in the chamber, please sign up on the sheet near the chamber entrance if you have not yet, so that we can make sure to call you when it's time for public testimony. If you are interested in testifying virtually, please email ron.cobb, that's C-O-B-B, at boston.gov for the link. And for all testimony, you will state your name, your neighborhood, or affiliation, and try to keep your comments to 2 minutes. Thank you. Today's hearing is on docket 1447, which was a resolution calling for a state of emergency at the intersection of Massachusetts Avenue and Melnea Cass Boulevard area, and also docket 1450, in order for a hearing to discuss the humanitarian crisis at the intersection of Massachusetts Avenue and Melnea Cass Boulevard. These two hearing orders, the resolution and the hearing order are very similar, so I thought it would be effective, efficient, seeing as though the panelists that we invited would be able to speak on both dockets together. So I will start with my opening statement. I will allow councilors in the order of arrival to start with their opening statements, and then we'll go forward with the panelists. Thank you. So for me, this was an important opportunity to hold this hearing for the public to hear from the Boston Public Health Commission and other city officials about the crisis at Mass and Cass. I do think it's a shame that the administration is willing to forego this opportunity. We all know it's a tragedy, and it's, in my opinion, unprecedented in our city's history in both its severity and its duration. We will, all of us, be judged on how we respond to this tragedy. So far, I'm afraid, I think many would agree that the city has fallen short in its response, and the lack of accountability is deeply troubling to me. Nearly a month ago, we wrote to the members of the board of the Boston Public Health Commission, myself, Councilor Flynn, Councilor Baker, and Councilor Flaherty, asking them to vote to declare a state of public health emergency at their September 13th hearing. We got no response, which, to put mildly, was disappointing. So we wrote a second letter before the September 13th meeting. I believe, and I know some of my colleagues share the sentiment, at the very least, the public is owed answers. We have a humanitarian crisis on our hands. If the resistance to declaring a public health emergency is rooted in the rationalization that the scope of the problem is too large for short-term measures for this matter, I have to say I reject that reasoning as flawed, short-sighted, and frankly not true. We need to do something, and I hoped from hearing from the panelists today, those experts who are down there day in and day out and understand the need more than any of us here, would be able to give us answers and help equip us going forward, especially before Thursday's government operation meeting to discuss the ordinance that the mayor has put forward. So that being said, I will go to opening statements. If anyone would like to give a quick opening statement before we get to the panelists. First, Councilor Tanya Fernandez-Anderson.
Thank you, Madam Chair. I am curious, though, who are the panelists that are here? I don't see anyone.
Yeah. I was going to list that after we got an opportunity to give opening statements. I'll address that after opening statements.
I see. Are panelists here, though?
Yes, there are panelists. There are
Okay.
community members and others who have come.
Not from the administration?
Nope.
Okay. Well, thank you for this filing, and I'm interested in the conversation. Obviously, I think it's safe to say that all of us are concerned. By all of us, I mean my council colleagues. And I guess now curious about how do you have a conversation with yourself, or I guess it becomes a community conversation. So
I do
looking
think,
forward.
though, I will say that if people are choosing not to do the right thing, I think for me, it doesn't stop me from wanting to continue this conversation. That needs to happen.
I can appreciate your patience in working with the willing. So I was just asking clarification to clarify whether or not we were having a conversation with administration today, and I'm happy to stay and discuss or have a discussion with the community.
Thank you.
Thank you.
Thank you. Councilor Flaherty.
Thank you, Madam Chair. I'll yield my time to members of the public who are here to offer testimony.
Thank you. Councilor Baker.
Good afternoon, Councilor. So I guess nobody's here to listen to our concerns. Okay, that's telling. I'll hear from the community. I think we all know what the problem is, and you know, we should be able to work together on this, but if we're not I think people like to use the term, if we're not allowed at the table, we can't help. So, thank you.
Thank you. Councilor Durkin.
I'm thankful for my colleagues for caring deeply about this issue. Homelessness, substance abuse, untreated mental health conditions is a major concern of my constituents, and I care deeply on a moral and personal level about this. I'm excited to see the mayor's administration is acting on this issue with an ordinance, Docket 1373, which will be discussed on Thursday's hearing at 10 a.m. Look forward to the opportunity to work with the police and public health commissioners and other administrators who will be joining us on Thursday to review this new policy. The current situation has caused our police officers to make sensitive judgment calls about removing tents in lieu of a standard response. This is tough because we already ask our first responders to make a lot of tough judgment calls, so I think this ordinance is needed. But since the ordinance will be discussed on Thursday, I'm planning to talk about that then. So for the sake of our first responders, I think Thursday's hearing is really where we'll discuss that. And given that the Boston Public Health Commission has already shared their determination that the situation at Mass and Cass does not meet the legal definition of a public health crisis, and I think we'll be discussing the issue in depth on Thursday. I will not be fully engaging in this hearing. However, I do appreciate the chair's work to raise community voices who are concerned about the heartbreaking situation at Mass and Cass. And I'm grateful we have the opportunity to hear from Bostonians and get their voices on the record. I look forward to hearing as much testimony in person as my schedule allows today, and I will review the additional testimony on the committee report. Thank you.
Councilor Flynn.
Thank you, Madam Chair. Thank you, Councilor Murphy, for chairing this important hearing and for sponsoring these dockets along with Councilor Baker, Councilor Flaherty. This humanitarian crisis at Mass and Cass is both a public safety and public health crisis. It requires resources at the city, state, and federal levels. The tents and large encampments at Mass and Cass are the sites of drug dealing, human trafficking, violence, and other illegal activities. These tents must be removed immediately. The selling of drugs, those involved in violence and human trafficking, must be arrested and prosecuted. I will continue to advocate for the urgent need to arrest individuals committing acts of violence and showing no regard at all for human dignity, including gun and drug traffickers, those engaged in the exploitation of women, and individuals assaulting outreach workers or first responders with weapons. As a former Massachusetts probation officer, I supervise returning citizens with access to drug treatment programs and employment opportunities. In 2017, I recommended a plan to operate a ferry service to the Long Island campus, and we need to expedite the rebuilding of the Long Island Bridge and building facilities to provide those suffering from substance use with the recovery services. While it's important to remain compassionate to our homeless community, the escalating crime and violence in mass incarceration requires difficult decisions. This crisis and its negative impact on quality of life and public safety are impacting mass incarceration, but also other neighborhoods, such as Andrew Square, Nubian Square, Clifford Park, South End, Roxbury, Dorchester, South Boston. Moreover, the situation continues to harm our small businesses, nonprofit partners, and the local economy. At this time, the status quo is not an option, and we must provide positive leadership to improve this emergency. Thank you, Madam Chair.
Thank you, Council President. Councilor Louis Jen?
Thank you, and I want to thank all the community members who are here. This is an untenable situation for everyone involved, and it has been untenable really since the closure of the Long Island Bridge, and so we have a lot of work to do there. I want to echo my colleague's statement that, on Thursday we're going to be discussing docket number 1373, and that will be the forum in which we'll discuss how we are addressing this untenable situation that I believe was scheduled, I know actually was scheduled prior to today's hearing, and is on everyone's calendar for us to have that discussion. Tomorrow morning, as I'll be in the area with neighborhood groups. I sorry. Yep, I'll be with you tomorrow morning very early on as we continue to look at the situation. As an at-large city councilor, we know that it is unfair for one of our neighborhoods to really be having to a disproportionate amount of the effects of what's happening there. It is an untenable situation, especially for our most vulnerable populations down there. When we look at our LGBTQ plus population, when we look at our couples who are down there who often have a harder time accessing shelter. Sue Sullivan, I see you shaking your head. Thank you for being here. And when we look at those who are suffering with the disease of addiction, it is untenable. It's untenable for the people there. It is untenable for the city of Boston. We need to think about how we address this issue in partnership with our state. We think about this as a regional issue when we look at the folks who are down there, not that trying to push the issue off to any other city or to anywhere else, but it really requires and demands that our state is at the table and that other cities and jurisdictions think about what their role is and how they are held accountable to their folks who are suffering from mental health issues, from homelessness, from drug addiction. We have communities, cities, and towns that are fighting MBTA communities to build more housing in their cities and towns, and we need to have an all-hands-on-deck approach. So I look forward to Thursday's hearing, again, so that we could go into more details. I apologize to members of community. I already had, before this was scheduled, I had a meeting in community scheduled that I have to leave for, but know that this is a matter that is not only important to the councilors that you see here. I know that it's important to the councilors who aren't here. It's obviously very important to the administration, as there's been that ordinance filed, and I look forward to continued conversation so that we can get this right for the residents who live there, for the business owners who are there, and for the humans who are there whose dignity is stripped every day by their presence of tents and by the untenable situation that is at Mass and Cass. So thank you.
Thank you. I just want to be clear, as the chair and the sponsor who wrote this hearing order, that this is in no way a duplicate to what we will be doing on Thursday, which is the scheduled meeting that Councilor Arroyo, as the chair of government ops, scheduled to go through the ordinance that the mayor had sent over to us several weeks back about having the council vote on whether or not tents should be removed. I'm going to read, it's short, but I'm going to read this hearing order so it's clear, because nowhere in this hearing order does it mention tents or talk about the tent ordinance. A resolution calling for a state of emergency at the intersection of Massachusetts Avenue and Melnea Cass Boulevard, whereas as the chair of Public Health, Mental Health, and Recovery, I asked the Boston Public Health Commission to vote at its meeting on Wednesday, September 13th, on a state of emergency in this area. I will, just for a side, mention that on October 19th, 2021, then Acting Mayor Kim Janey unveiled her Mass and Cass plan and declared the addiction and homelessness a public health crisis in this area. The request was in hopes of addressing the dire situation with a sense of urgency, one that this body, in the light of the fact that we have received no response, does not share. There was no other assumption that any of us who wrote that letter to the Public Health Commission board members who gave us no response, there was nothing else I could think that they did not take it as seriously as we did. We need to respond to the ongoing tragedy of substance use disorder, mental illness, open use of illegal drugs, violence, criminality, and disturbance of urban life that has gone on far too long. We have reached a stage where dramatic intervention is vital in this area, and we need real solutions that address underlying problems and causes. I will again say that in no way does this mention, even though it would be part of a bigger conversation about the legality of whether or not we can remove tents from this area. The chair of government ops, when this was brought to the council at the last Wednesday meeting, did object to us taking a vote, suspending and passing this at the meeting, because he said he knew that there was a hearing order and a meeting scheduled, and he looked forward and thought that we needed more information, which in my opening statements I made clear that this is an opportunity for the public and us as a body who will be taking a very important vote to hear from the Public Health Commission, the businesses, the residents, the first responders, all of those who are down there every day. Before we go to the panels, I do just want to read the panels that I invited so it's clear to everyone that unlike an ordinance that would be dealing with the legal department and making sure we're going through the wording of the ordinance, that it would have been a very different hearing today. Questions that many of us have because of the severity of what's going on there. But I invited Tanya Del Rio, Director Coordinator of the Response Team, Jennifer Tracy, Director of the Mayor's Office of Recovery Services, Dr. Basola Ojakutu, Executive Director of the Public Health Commission. I also invited all of the board members, Rebecca Gutman, Philomen Laptiste, Gual Valdez, Greg Wilmot, Sandra Galea, Elsie Tavares, and Alistar Bell. Also invited was Paul Burke, the Fire Commissioner, Michael Cox, the Police Commissioner, James Hooley, the Chief of Emergency Medical Services, Captain Hussein, who is the captain in B2, and Captain Boyle, who is the captain in District C6, where Council President Flint knows that that is the captain that covers that area. As we see, they decided to not come, and as some of my colleagues already stated, there's this misunderstanding that this was in some way going to get in the way of Thursday's meeting or wasn't on the schedule quick enough for people to attend, which I just want to be clear, in no way it is that at all. But because we do not have anyone from the administration attending, I will go to, we have been joined by Councilor Mejia, thank you. So I'll give you an opportunity for opening statements, and we will go to the second panel who did show up, so thank you.
Thank you, Chair. Surprisingly enough, I don't have a lot of opening statements other than I came here to listen and learn. And I think that we are at a moment where we need everybody at the table if we're really serious about addressing any issue. And so I'm looking forward to a conversation that does just that. Thank you.
Thank you. So I do see that we have Sue Sullivan is here. If you could come forward, or if they're, I don't know if Bob is going to zoom in, if we could see if some of the people are on Zoom. And George, if you're here also, if anyone from the community has come, if they'd like to come down and lead the panel. And when I do call, just so the public knows, if you could just state your name and your affiliation. And I will start with Sue Sullivan, please. Thank you.
Thank you, Chair. Sue Sullivan, I'm the Executive Director of the Newmarket Business Improvement District.
Thank you. Sorry. Yeah, he'll make sure you're please.
Hi, I'm Tim Nee, and I volunteered down in that area with a church and some other churches called Miracle Mile Ministries.
Thank you.
Brian McCarter. I just own one unit right abutting the proposed shelters.
Okay, thank you.
George Sturgios. I am the Vice President of the Worcester Square Area Neighborhood Association.
Okay, thank you. I'm not sure if you've come prepared with some opening statements, or Sue, if you wanted to start with some updates. I know we do talk regularly. And I do just want to state that when a small area in our city is suffering so badly, and it's referred to by everyone as a humanitarian crisis and a state of emergency, I don't think having 2 meetings, 3 meetings, even 20 meetings on the issue. I say this about the Boston Public Schools often, right? That some of the, inequities that are being suffered by many in this area deserve our time, even if it means more than 1 meeting. So thank you for being here, and thank you again to my colleagues who attended.
Thank you, Chair. And I do appreciate having the meeting, and I always appreciate any time we get the opportunity to talk about what truly is a humanitarian crisis, public health crisis, public safety crisis. In the area of Newmarket, known as Mass and Cass, but also it's not just about immediately right there. It's the impacts on not just Newmarket, but the South End and the Roxbury and South Boston and Dorchester and beyond. And I think that's what we really need to think about is what this crisis means to all of us.
Thank you. George, and then I'll go to...
Yeah, I guess I don't understand. Are we going to make an opening statement and
If
then...
you'd like to, yeah.
Or
and
are
then
they
if
gonna...
people do have questions for you, or if you have questions, I would have assumed that you may have had questions for the administration after they shared. They're not here to share, but you are welcome to give an opening statement so those we can hear your concerns. And
how long is an opening statement?
How about we start with 3 minutes, and I'll let you know how that goes.
Okay. I'm gonna see how much I can get through then. Okay. I think that, and Ruth Z mentioned this, and there is a general misunderstanding of this crisis that it started with the closing of Long Island. And it did not start with the closing of Long Island. It started when Boston Public Health made a decision on its own to centralize all the needle exchanging. There used to be several vans that used to run all around the city, and they decided to do it all in one area. Now, once they did that in one area, they found 2 years later, they're saying, we're handing out 3 times as many needles. What a great success. They brought addicts who needed needles, drug dealers saw that they didn't have to cover West Roxbury and Roslindale and Back Bay. They could just come to Albany Street where they're picking up needles. And then more people, when they couldn't find their dealers, decided they'd come to Albany, and we ended up with most of the drug dealing. And basically, Boston Public Health began established an open-air drug market. And this is where the problem started, not with the closing of Long Island. In fact, there are YouTube videos calling this area Methadone Mile that were done the year before, several months before this. So that is the real problem for me, is Boston Public Health. Boston Public Health created this crisis. It created this crisis, and I will say that it's done very well. It's been bad for the Newbury, for the businesses. It's been bad for the neighborhoods, but this has been great for Boston Public Health. If you look at from 2017 to 2024, their budget went from $75 million to $125 million, and 60% of that during the 4 years I can find figures went to either EMS or to addiction services. So I believe that Boston Public Health is the wrong people. They have the wrong set of incentives. Every addict for them has a dollar sign on them. This is how they get money from the city council and from the city. And I think the only way to solve this, yes, we have to take down the tents, but the most important thing we have to do is take this out of the hands of Boston Public Health. Because for them, this has meant huge increases in headcount and huge increases in budget. And that's how government works. For them, this is a success. We see it as misery. They see it as things couldn't be better.
Thank you.
Yeah, I'd like to just say, I'm in the area not as often as some people, but I do go down into that area on Atkinson Street, and it started out as just a row of tents. Now it's 3 deep, and there's sludge, there's slime, there's rats everywhere. You know, it's people passed out. You know, I stopped to see if people are breathing sometimes. I seen a guy just last week, his face was in a pile of trash, and he was breathing, and I walked up. We invite people to a breakfast we do on Saturday mornings. We get about 70 people, not all just there, but other people come. You know, so I believe there's a spiritual aspect to this, and we want to see, I just celebrated 24 years clean and sober. Thank you to my God, you know. But it's heartbreaking to see the misery that's down there. It really is heartbreaking. I've seen open sores, infections. I've seen people, I seen a guy one time trying to point to his friend around the infections of where he could stick the needle in, you know. So to say it hasn't risen to a criteria for a public health crisis, I don't understand what would rise to that criteria, because what I see is misery down there. I've seen 4 people die in front of me. If it wasn't for Narcan, they'd still be dead. You know, it's a very sad thing. The last person that I saw come back from Narcan, she screamed, which it could have been used in any horror flick. I think she saw hell. That's what I said to my friend. I think she had a near-death experience. So there's people dying down there. And I think the tent should come down too. I agree with a lot of what was said over here. I think people should be arrested. I think people should get sick and tired of being arrested, and maybe they'll look up one of those times they're arrested. I had several one-nighters myself, and it makes you think, you know? So I think they should be arrested. I think the tent should come down. If there is a state of emergency, I don't know what that looks like, but I would say a curfew would be part of that, you know? So if they're going to enforce it. But I saw when the mayor came in, they did tear down all the tents at one point. And when the first tent went up, that tent should have come down. But they allowed more tents to build up again. It hasn't gone out into the surrounding areas again. But, you know, I'll just say, you know, when some of the community took their people out a few weeks back, and Fox News was down there, we had a prayer walk planned for that neighborhood. And there was over 100 people. They expected maybe 20 of us to show up to just walk the neighborhood and pray. And there was over 100 people. There's probably like 120, 150 people walking the streets. And Fox 25 is there saying the volunteers have left because there's been stabbings. And here comes 100 people walking down the street. They say, who are you people? You know, so the churches do care. The group that I belong to, Miracle Mile Ministries, there are former addicts and stuff. We know freedom is possible from this. And I want to see that. I mean, there's people's mothers, brothers, sisters, aunts, uncles. There's people out there. There's human beings out there. And I'd hate to think that anybody likes the status quo. I know there's money making to be made. I'd hate to think anybody likes the status quo. So something definitely has to happen. I don't know what that is, but I hope you consult some of the pastors and stuff in Miracle Mile Ministries, see what their views might be.
Thank you. Appreciate it.
Hi, my name is Brian McCarter. My original plan was to come here today and ask the City Council if they have a copy of the mayor's plan to address this, since I've tried to request this. And from the comments I've been hearing, you've been rebuffed as much as I have been. Through the Freedom of Information Act, I tried to get the permits, and all I found was a certificate of egress inspection, which amounted to a change of use of one of the parcels without any public hearing. And it says capacity of 80 people. When they keep going on and saying it's going to be a 30-person shelter, I've got the permit here, it says 80. I've also got a letter from the Boston Public Health Department to Inspectional Services requesting these permits. They reference plans that have been sent to Inspectional Services. With the letter in hand, I've tried to request those plans, and I've not been able to get them. So I'm wondering if the City Council has the ability to order something that I have in writing exists from the city to be provided to the public.
Yes, we can definitely try. Sometimes I don't get things I ask for, but maybe some of my colleagues can help me get that.
Should I enter what I found into record?
Absolutely. That'd be great. I'll make sure we get that. You can leave it there. I'll make sure before you leave. Thank you. I'll go back in order of arrival from my colleagues. If they have any just general statements or questions directly to those who are here from the communities that are down, who are residents, business owners, supporters, which we know many people do show up every day to help. But Councilor Fernandez-Anderson?
Thank you, Madam Chair. From what I understand, I had to ask the administration what happened, why aren't they here? And I guess the clarity that I received was that because of the hearing on Thursday, they feel that it can all be one conversation on one date, and it's, inundating to attend 2 hearings in 1 week for department heads, and I understand that, but it makes this conversation here difficult. And then the assumption, for us, I guess, to leave the onus on us to assume that that conversation of this topic here, deeming this issue as a public health crisis, that it would be included in that conversation under the ordinance that was filed, I think is a little, I guess it's just counterintuitive, because then I was ready to have a conversation here today, and I wasn't aware that the administration wasn't showing up. I'm glad to receive this letter from the administration today, specifying that folks can't, be here. However, again, I was looking forward to the conversation. Considering that we have a wealth of resources here, community folks that have been working profusively on this topic, all people whom I respect. I guess I look forward to the conversation on Thursday, and the question on what you filed, Madam Chair, is whether or not this should be deemed as a public health crisis. I spoke with Dr. Jakutu, just asking her where she was with this, and I guess it's more about, whether or not it would make a difference in terms of, funding wise, if it's deemed, public health crisis, then should it come with an investment, right, in order for us to work on that public health crisis. You see that with racism, when it was deemed public health crisis under Mayor Walsh, then after that, what was that investment to dismantle systemic or just racism in the city of Boston? And so my question, I guess, is more to the chair. What were you thinking in terms of, your thoughts
Absolutely.
about it being a public health crisis, and the why or why not, and what did you see as a plan
Sure.
to
And
work on it?
So you may have stepped out to get clarity when I did, were you here when I read the order and explained? Yeah, so, and also this hearing today is not just on the docket to declare a resolution declaring a public health crisis. It's also on the hearing order to discuss the humanitarian crisis in this area. So it was a hearing order which I combined with the resolution, and it was Councilor Arroyo who had stopped the vote last week, but I agreed when he said he looks forward to this hearing order on the docket to get information, so we have more information. And nowhere in my hearing order or in my resolution calling for a state of emergency do I mention the tents in this area. The conversation, as you know, we've been in several government operation hearings where we've gone through ordinances, and it's really deep into the legal language of how it's written and what changes to the wording we want. And I really did believe that the administration, and you mentioned maybe a burden on people. I know we as councilors, our jobs are very important, and we're at several meetings every day. And if something to this level where a neighborhood is suffering so bad, I don't think 2 times in 1 week is too much for somebody. And it was the only available time. Last week, we all know there was lots of council hearings last week. Every time last week was taken. The first one I could have was today at 2, so I took the first available. It was closer to Thursday's meeting, but we go to meetings a lot. Department heads have lots of staff that can help them, right? So I do believe that coming here today would have given us the answers that we then could have gone into that ordinance hearing with much more information. We all have a different level of understanding. We all have a different level of interaction with what's going on down there for many different reasons, because we might be district councilors outside of the area. We may be, as the chair of public health, as someone who cares greatly in those suffering, that it means a lot personally to me. So I did hope for coming out of this hearing that we all would leave with a better understanding of what will happen on Thursday and how our voices and our vote will make a difference or if it wouldn't. Because the vote about a tent ordinance, which is now put on us as councilors, is going to be tied to housing and other things that are going to be very legal questions that we have on Thursday.
Thank you, Madam Chair. If I may, I guess the other, for me to go on record as to where I stand with this, I do agree with you. I think it's unfair that there is no one here to answer questions. So say that the chiefs or the head of departments are busy, and they are very, very busy as well. Then send, as you said, send a representative, send one person that can, and I think that...
I read the list, it was the long list. Somebody could have shown up who has the knowledge and has the ability to answer the questions.
Thanks for adding that. I think that, I think that out of respect for a collaborative work between administration and council moving forward, respect is patient and professional. And I think here, I feel for you because I think that we are human beings, and I wouldn't have just totally not shown up. No, and so as far as my position on this, I think that, I've mentioned Lisbon, Portugal several times, and I don't think that, between council and public health, we haven't had a fair opportunity to actually explore their Lisbon, Portugal's plan. And it really does speak to, I think, a consolidated sort of ideologies of different folks that have been expressing this for such a long time in terms of a more moderate approach, in terms of harm reduction combined with alternative plans, in terms of actually bringing in, arresting folks without criminalization and bringing them in front of a panel, and then giving them the options to go into treatment with, again, a panel option of social workers, psychologists, and housing resources and so forth. It feels like the strategic plan that Boston Public Health Commission has online does not synthesize a user-friendly approach for folks to be able to comprehend or to be able to say, oh, I understand your metrics, I can monitor the progress here, and I can definitely measure the growth. And so if the community has a problem with understanding where the progress is made, then obviously the issue is with the delivery. The issue is how they're presenting it. And so I would say that we have a lot of issues. I think John Santiago, Sue Sullivan, and myself, then Rep. Santiago, we nailed the whole concept of, along with Steve Fox, with the concept of metrics. Finally, we get a dashboard, but your dashboard is not again, not user-friendly. So that's one issue, and I think that Boston Public Health Commission has done tremendous work around this, but the issue is in the lack of synthesizing the coordination between city services and state services and community. And so when we talk about wraparound with any harm reduction approach, we have to, the success comes laid out in the coordination. So if it's wraparound, it means that there is an umbrella to actually not duplicate services and to have a holistic approach. So I think that on a public health perspective, I feel like that's lacking. There's some sort of disconnect, again, between city resources and state resources and community, and some doubling and some lacking. And then in terms of arresting or removal of tents, I definitely 100% agree with removal of tents. I am eagerly looking for the backup plan, the comprehensive backup plan that says we are going to contain this. We have a manageable plan that is not going to seep into our neighborhoods and doorsteps and backyards, or that when it does, we have a crisis response plan or action plan that addresses each issue, small or large. So considering that I am the City Council for District 7, most of the issues are in my district. And with all respect to Councilor Baker, who has been a strong advocate on this issue for way longer than I've been here, way longer than I can probably worked on this. You know, the Shattuck is in Grove Hall, which is in my district, Albany Street in my district, Mass and Cass in my district, post redistricting. And so it seems like the burden is all on District 7. And then District 7 shares a whole lot of the majority of, you know, either what we used to call them halfway homes or recovery homes, or low entry homes. And that burden, we're starting to feel it. The community often talks about the disparity between South End and Roxbury, but it's starting to sort of even out, which is sad, right, and disappointing, where the problem is so large that it's just felt just as equal on both sides. And Nubian Square suffers, and you see no resources other than those that come from independent nonprofits or programs of volunteers. The Nation of Islam, for example, or the Nubian Foundation, or the vans that come from Mass General. But the coordination, again, of services is not actually addressing. Nubian Square is filthy all the time. There are people hanging there 2, 3, 4 in the morning. And then you go into Albany, you go into Mass Ave, you go into Concord Square, Worcester Square, Springfield Street, all of those areas, they're all in between. And I'm getting bombarded with emails, and I mean over 100 a day, about whether it's needles or clothing or loitering, or it's just everywhere, right? So I'm not convinced that just filing an ordinance to remove tents can actually address this issue. And then the other part is, I'm interested in listening from BPD to understand, are they going to be allowed to actually arrest criminal activity? Are they going to be allowed to be able to separate that? And then will they be supported with a crisis team that will be able to mitigate whether you're going to service or you're going to be imprisoned? And I think that BPD has expressed that they're discouraged because when they get arrested, they have to let them go. But then if there is no, again, comprehensive backup plan, we're just going in circles here. So I don't pretend to know the answer. That is my position. I want the tents removed. What is a comprehensive plan? Can BPD actually do their job or allowed to do their job? And how are we going to clean up our streets in terms of, you know, the tents that will go in our backyards, will go on our doorsteps? Thank you for indulging me. Thank you.
I appreciate it. Thank you. Councilor Flaherty?
Thank you, Madam Chair. I don't know about anyone else, but I've lost complete confidence in the Boston Public Health Commission. We saw it during the pandemic. We, as a council, met every single day with the administration, public health, public safety, housing experts, food distribution, vaccine sites being set up every single day, multiple times during the day. Boston Public Health Commission, they didn't meet daily. They didn't meet weekly. I think from the start of the pandemic, they might have met 5 or 6 times from throughout the year of the pandemic, and the year following, I think there was a total of maybe 12 to 14 meetings tops. They regularly only meet every 2 months. During the pandemic, they actually met less. So whether they declare this a state of emergency or not, I have zero confidence. Even if they did call it a state of emergency, like they called the pandemic, they basically turned everything over to the city anyways, and I'm asking that they do that here. I tend to agree with some of the panelists that they're part of the problem, that they're enabling the situation over there. They pass out 1 million drug kits a year. Those drug kits contain needles, pipes, tourniquets, cotton balls, cooking trays, all of which, by the way, after they're discarded, end up in our parks and our playgrounds and our ball fields. And they look something like this. You know, it's a package of needles, and a syringe, and a tourniquet, and cotton balls, and a cooking tray. 1 million. Boston Public Health Commission passes out 1 million of these every single year under the guise of harm reduction. I call it under the guise of enabling. We learned a long time ago, for the gentleman that's in recovery, and congratulations on your journey and your one day at a time, that it's sort of a part of it is tough love, right? You know, when family members are lying to you and they're stealing from you and they're not straight and they're not sober and there's chaos in your house, you have to sort of push that away in hopes that they hit rock bottom and then they come back to you asking for help. And that's when the family stays involved, and we work on intervention, or we work on treatment and recovery, and it starts with detox. Rock bottom is a bottomless pit, I believe, over at Mass and Cass. None of those poor souls are finding rock bottom. 85% of them are not from Boston, but those poor souls that one would think would have hit rock bottom by now, to come back to their family so that their parents and their siblings, their loved ones, could wrap around them and get them detoxed and get them into recovery and kind of get them back straight and sober and functioning. I believe because the Public Health Commission is passing out 1 million of these a year, both for heroin and crack, folks over there are not capable. They're not capable of making a good, sound, practical, reasonable, healthy decision for themselves, meaning that we have to do it for them. We could be their family members, we could be law enforcement, we could be folks in recovery. I think our strongest and best weapon right here against this issue is folks in recovery. Turning this over to John McCann. It has to get out of the Public Health Commission. It absolutely has to get out of the Public Health Commission. They are almost kind of in the way of a solution. And they continue to hang their hat on harm reduction when nobody over there is getting their life back on track. No one over there is getting detoxed. Our other conundrum is we're now potentially going to be handing folks out a set of keys when they're not straight and sober. And I can just tell folks what's going to happen. An individual who's not straight and sober that gets a set of keys to a housing unit, most likely they'll sell the keys for drugs, trade the keys for something else, lose the keys, or invite folks over with the keys to get high. And so putting sort of housing before recovery, I think, is also a major misstep. But again, under the guise of the housing homeless crisis and under the guise of harm reduction. That's sort of this conundrum that we have in the centralized services over there. And I said, even if we open up, if we could snap our fingers right now and have the Harbor Islands fully functioning, no one's going to go over there if the hustle is still over at Mass and Cass, being fueled by South Bay Mall and those that are running the street game. That's where the action is. That's where the community is. I don't go out the Harbor Island. No one wants to be out the Harbor Islands. There'll be more folks trying to swim back to Mass and Cass. That's the reality of it. So I just want to deal in reality. I want to deal in what's happening over there on the ground, that no one's getting treatment and recovery, no one's being detoxed, no one's getting their life back on track. Numbers are growing significantly, arguably from people that are not from Boston. Which, from someone that's in public office, other mayors, other city councilors, state representatives, other government officials, they get to skate on this one. It all falls on Boston. Mass and Cass, the opioid crisis, which is a regional problem, which deserves a regional solution, has fallen on Boston. The housing crisis has fallen on Boston as well, and homelessness. But all these other cities and towns, right? Their residents are over at Mass and Cass, because of the free-for-all that's going on over there. It has to stop. And so despite the fact that Public Health Commission is not here today, even if they were here today, I have zero confidence. It starts actually from the pandemic and how they abdicated their responsibility, and they didn't meet daily. Not only they didn't meet weekly. We met, and they turned everything over to the city. I'm asking through the chair that we ask Public Health Commission, turn this issue back over to the city. Let folks in recovery that know this issue better than anybody. They know the tough love part of it. They know how to get someone into detox. They know how Section 35s work. They know when someone's ready for recovery. That has to happen. We should be turning it over to those on the street that know recovery better than anybody. Instead, we're deferring to the Boston Public Health Commission, who continue to exacerbate the problem with this and all the other giveaways over there. It's a disgrace, frankly. And so no one over there is going to get to rock bottom when we're enabling with this stuff. And unfortunately, as referenced, the contents of the packet and all these caps and needles, that's where they end up. They end up in the playgrounds and the ball fields, and where some young child, toddler, kid playing ball, going to the beach. They've recovered them on Carson Beach. They've recovered them down behind the Elm Street bathhouse. They're all over the place because we're giving them away. And so until that issue gets answered, and how we're not doing it and we're not managing it, just handing out a packet but not engaging in a recovery conversation, it's flawless from the core. Before they get the packet, they should be asked or encouraged to be detoxed. It's almost path of least resistance. So again, those are my issues and my feelings about trying to solve this issue. And unfortunately, it's not going to be the Boston Public Health Commission that does it. It needs to be a partnership with multi-agencies, but I really would like to see folks in recovery, like the John McGanns, being consulted as to what works and what doesn't work. You guys know how to help get someone's life back on track. You know how to get someone into a detox. You actually also know where the beds are for detox. You know which ones take insurance and which ones don't. That's the partnership that we need. We need folks that are in the recovery community front and center on this one. Public health needs to sort of take a back seat and allow folks to get kids and young men and women into treatment to at least have a fighting chance at trying to save half the population over there before we can go any further. So again, I appreciate the chair's indulgence offering this hearing, but frankly, even if there was success here and even if they did declare it a state of emergency, zero confidence from this corner of the world with respect to how they would handle it, how often they would meet on it, what their solutions would be, because we had a front row seat during the pandemic and they mailed it in. Thank you, Madam Chair.
Thank you. Councilor Baker?
Thank you, Madam Chair. And I don't think that this hearing really has anything to do with an ordinance. An ordinance, I know where I'm voting. It's up or down. How much are we going to talk about that? My opinion on the ordinance is we don't need the ordinance to do what we need to do. We can go in there now, we can remove tents. There's been systems put in place where we engage with the outreach team, the police outreach team, and public health professionals, where we engage and we say, okay, I'll use your name, Eddie, we're gonna move you out. We'll give you 3 days. We'll be back here in 3 days. Here's a couple things. We'll hold your stuff. So we don't need the ordinance. That's about trying to spread blame around. If my voice were being listened to a little bit, I got no problem taking some of this blame. But my ears are still bleeding from 2020 listening to people talking about transparency and accountability, transparency and accountability, transparency and accountability. We don't have anybody here to say how many ODs are going on in the city of Boston a week. I just got a number that there's a week, 50 of them a week, most of them happening right down in the south end in that area. 50 a week. Imagine if we didn't have Narcan. Is that a public health emergency yet? Public health emergencies would allow them to be able to do things like what you talked about, change the zoning without really having a process, which they do anyway. The Roundhouse Hotel is a perfect example of it. They went in there. There's no change of use, change of occupancy. There's no, this is what we're going to do. a public health emergency would allow you to do those things. That happened during our public health emergency in 2020, which subsequently went into longer years. We've spent millions and millions and millions on failed programs, putting people into housing. This ordinance is about housing first. That's what it's about. We have the ability to do what we need to systematically go in there and say, okay, we're going to section Eddie today. If you start sectioning people, they go, wait a second, we can't openly use, we can't do whatever we want. Couple sections a day. But the problem is we don't have the real programs for those sections. Whether if they are mandatory sections or someone decides to say, I'm sick and tired of being sick and tired. I put my hands up, I surrender. I'm going into that program that's going to allow me to go to a repurposed government building. Whatever that government building used to be. Did it used to be a jail? Well, it's a public health facility now. Right? And allow people to stay in those places. That's where we need to be spending our money, not on let's give Eddie the keys to the roundhouse. I bet if we did a study, we like doing the studies in here and where people are. If we took the however many people that went into the roundhouse, 300 people, by the way, we spent 25 million, I think, still can't get quite an answer. Even if it's 10 million, it's too much. Because it's a failed program. If we spent the 25 million, which I think the number is on just the roundhouse, 25 million, if we spent the 25 million on repurposing Nashua Street into a DPH facility that we could hold people for 6 months, 3 months, 6 months or 9 months, I think we'd have a chance here. But if we looked back at those people that we let into the roundhouse 3 years ago, and we followed them for 5 years, I would bet 98% of them are going to be dead at the end of 5 years. 30 years ago, my brother Ricky died of a heroin overdose. March 3rd. This was his 30-year anniversary. I had taken him to a detox probably 10 years before that. And he said to me, and I knew he was on heroin back then. Nobody saw heroin. Nobody knew what it was. Nobody realized how bad it was. And also back then, people were shooting heroin that was 5% pure, 6% pure, maybe. And he says to me, I got to take a hit before I go in. I'm like, okay, what does this mean? Bang, right in his arm. Oh my God, what was that? Who would do that to themselves? A sick person would do that to themselves. We're dealing with sick people right now, and we're not giving them the resources. We think that allowing them to stay on the sidewalk and give them, I think the package should have gum and cigarettes in them too. I'm gonna make a motion on that. Anyways, we think that we're gonna get them healthy, allowing them to stay there. If you talk to people that have been dealing with homeless for years, not this new, because it's a drug market down there. It's nothing other than a drug market down there, and it's a party. If you deal with people that deal with the homeless, they will tell you the people on the street have the absolute worst quality of life than anybody in our whole society. And we're talking about, it's 3 months now talking about an ordinance. An ordinance? You have the jurisdiction to go in there now and take them out. And we're wasting time on an ordinance. We can already do that. So I'm very upset here today that we can't find out how many ODs are happening there. Where, other than the south end, are people gravitating to? Back to your point, and I'm jumping around a little bit here. You asked for the plan. I'm city council 12 years now. I was here before 311, when you used to literally have to call people 80 times to get something simple to happen. I went to a public meeting on this plan, which wasn't in the district where it's being affected. They took it away from the district. I was not even invited to it. Now, I've been dealing with this for the 12 years I've been on here. And you know what the plan was for, okay, once we start clearing people around, what are we going to do in, say, Edward Everett Square for the 12 people that are basically living there now? You know what the response was? Call 311, we'll send the police out. Call 311, that's the response. That's no response, because we don't have the police, we're not supporting them, and we're not talking about arresting. When you say arrest, everybody goes like, we're going to arrest them, we're going to put them in jail, we're going to throw the keys away. No, one of the things that happened during COVID was the courts closed down and we stopped picking people up off of the street for those violations that might be, you know, a quality of life violation. That person, when they come in, they've got 15 warrants and they're all drug warrants. In all probability, they're going to go in front of a judge in a drug court that says to them, you know what, back on you, Eddie. Eddie, all these are small. We'll clear them all up, but you got to go into long-term treatment. We're talking about housing first. That's what this ordinance is, housing first. It should be treatment first, and we should stop with the pounding people into houses, because every one of those houses becomes a party now. It becomes a party. Why do you think they don't want to leave the street? Because if you read the stories, you're consistently hearing about this guy that's from Rehoboth or whatever, that's living on the street, that's been here for 4 years or whatever, looking for housing. I'd say, can you go back to Rehoboth and see what they got for you there first? But they'll say to us, this is our community and the shelters have rules. My house has rules. You know, this is civilization. That's how we keep it in control, with rules. So I think we're heading down a wrong path here. Madam Chair, thank you for having this, even though totally disrespected by the administration not being here. Don't think that we have questions that we can get answered in a public forum. How many ODs are happening? And let's talk about mat therapy for a second. Mat therapy in the last 10 years has gone like this. You know what's also gone like this? Overdoses. Gone like this. Coddle, coddle, coddle. So, excuse me, I'm all about second chances. We're all about second chances. And by the way, I sectioned 2 of my nephews just this morning. It took up my whole day yesterday, finally got it done this morning. 2 of my nephews, not 1, 2 of them. I hope they get it. They're both on, that's your 100th chance, that's your 90th chance. You know, at what point do we say, all right, this is where you can go live now? It's not great, but you're making choices to continue on the drugs, and to say that we can't section people because it's not civil or whatever, it's not, you know, it's taking people's rights away from them. I would argue that someone that's shooting heroin or any poison, now it's not even heroin anymore. I beg for the days when we used to bring people to detox when they were just on alcohol, maybe cocaine. Now they're not even on heroin anymore. It's fentanyl and it's meth. At what point do we start getting real about this and putting people into treatment? I call for treatment first, not housing first. Let's get these people in healthy. All the people that we are talking about here today in the IDP hearing, it's housing, housing, housing. So what about those families that are looking for housing? You got to get behind the guy from Rehoboth because he's on the outskirts of life. He's an outrigger in life and chooses to continue, and it's his right, I guess, to continue to pump poison into his vein. But the solution doesn't happen one-sided. I hear an awful lot about all things are on the table. All options are on the table. They're not on the table. If you even mention Section 35 in a room with public health officials, yeah, you can't do it. So all options aren't on the table. So until all the options are on the table, I don't think we should be sharing, as councils should be sharing the blame that is over on the other side of the hallway. The ordinance is about sharing blame and nothing else. We don't need that ordinance. People should be here asking questions of the administration. I appreciate you guys coming out. I've dealt with you all for years, and I appreciate the work you did. But I want to say, when I think it started, in April of 2021, I think it was a Thursday afternoon, right outside the fire headquarters, 40 tents showed up. 40 tents, they all matched, all matching Coleman tents, maroon. I remember it, probably have pictures of it someplace. Those tents were given to people Down the other end of Mass Ave, they pointed them this way and said, go down to Mass and Cass, you'll get housing. Because this is what it's about. It's about putting people like that in housing before we put our people in housing. Poor behaviors are gonna get you housing. And it was a crisis that was generated back then by advocates handing out tents and saying, go get on the street. When I owned a restaurant, if I put a sandwich board out on the sidewalk, I had ISD one day come in, not ISD, the code enforcement, can't have that out on the sidewalk. A sandwich board, BLT with a Coke, $7, whatever it was. Get that off or we're gonna write you a ticket. But yet, this guy, he can lay on the sidewalk, set up his tent, he's got his cooker over here. It's totally backwards. Totally backwards. And until we rip that Band-Aid off and start talking about it real, there's a saying in the program, and I grew up in the program because my father made the choice to not drink. When he died, he was 56 years sober. If he drank when I was alive, I'd be more of a wild person than I am right now. So I thank him for that. And he did it the old-fashioned way, abstinence. Mention abstinence in a room of MAT people. Oh, you can't just tell people to get off drugs or alcohol. They might die. Well, they might die that next shot they take. So I appreciate you bringing God into this conversation because I think that's part of what we're missing, not to get too much into it, but the ministry works, and it's all about finding that we are all powerless over this stuff. We're all powerless. And if we allow this to continue, we're going to look back 10 years later, the balance sheet's going to be like, whoa, look at that. New York, $1 billion. LA County, probably $2 billion now. San Francisco, $1 billion. Billion. We're on our way to $1 billion. And we can't build a failed house. Thank you.
Thank you. Councilor President.
Thank you, Madam Chair. Thank you. And thank you, Councilor Baker, as well. Let me thank the panel for being here, for the work that you were doing. Had an opportunity to work with Sue for many years and with George as well, and the residents in the South End. Proud to represent about 2/3 of the South End, along with Councilor Fernandez-Anderson and Councilor Baker as well. Prior to my position on the City Council, I was a probation officer at Suffolk Superior Court, and I supervised the homeless community that was on probation. And my probation is, I probably had 60 or 70, maybe 70 at one time. And the majority of them committed their crime outside of Suffolk County, whether it was Essex County, Franklin County, Middlesex County, Dukes County, Hampshire County, Hampden County. But my point is, when they committed that offense outside of Suffolk County, they did their prison in the Mass Correctional Institute, and then when they were released, they were sent to Boston on the bus. So coming out of prison, you would get a bus, a ticket on the bus, and go right to Boston, downtown Boston. And where would you end up? Basically at Pine Street Inn. So these cities and towns across Massachusetts and really across New England were sending people to Boston to get services, to get housing, to get medical care, to get drug treatment programs, to have your probation supervision transferred over from Hampden County to Suffolk County. And then Suffolk County was responsible for you. And Boston was responsible for you for housing. Boston is a very compassionate city. It has always been a very compassionate city. I just think we're at this point now that we can't continue that same level of compassion that we have in the past. We don't have the financial means to do it anymore. We don't have the services to do it anymore. And for cities and towns to pass their problem on to Boston is unconscionable, in my opinion. And it's easier for a city or town to give someone a $30 bus ticket on Greyhound to go to downtown Boston than it is to provide a housing voucher for them or get them into detox and get them to a job training program and a drug treatment program. So I know my colleagues have mentioned that, and it's a national problem, but we can address it as a regional problem as well, a New England problem, but it's really going to require all New England states, in my opinion, to come together, deal with this crisis as governors or as leaders, and ensure that the towns and cities that aren't doing their part on this issue have to be at the table and have to provide services. And just wanted to follow up on a couple of points Councilor Baker mentioned. If my probationers would test positive for any type of drug, I was required really to bring them before the court, let the judge know that this person is currently using, which is a violation of the probation conditions. And most of the time we would recommend that the person do 30 days in detox. Sometimes the person would go to detox, sometimes, or most of the time, the person didn't go to detox. But I knew one thing, that once my probationers were using drugs, it was only a matter of time before they committed their next offense. And maybe the next offense was a minor offense, or maybe the next offense was a homicide. But someone using drugs on probation from a superior court would eventually commit another crime, usually within the next 7 days, the next 10 days. I guess my point is, following up on Councilor Flaherty and Councilor Baker, about the last thing I would advocate for that person that was using drugs would be to get him into a residential program, to get him housing. That person needed detox. That person needed to get that drugs, and it wasn't even alcohol, it was all drugs, get drugs out of their system and get on a path to a healthy living environment. And that could take 4 or 5 months. And it wasn't easy. And most of my probationers, almost all of them relapsed. Maybe 2 or 3 of them didn't. But you still never give up on people. You still support people. You'll still try to get people into detox programs. But getting someone into an apartment is not the right answer. That's an easy answer. Getting someone into a detox program is difficult because it's hard to get someone into a detox program. To get one person into a detox program, it might take you 4 or 5 hours just dealing with one person. And it's calling up and figuring out the insurance and calling back in the afternoon, seeing if there's a bed available, and staying on the phone and calling other people as well at the same time. So that's a difficult process. But I still think, even though we're in this crisis, we're in this epidemic, we're in this emergency, it's still critical that we work together. We know that it's having a devastating impact on people living in Mass and Cass, but it's also having a devastating impact on their families, but also residents living in and around that area, in and around Mass and Cass, South End, Roxbury, Dorchester, South Boston, other areas. The closest MBTA stop to the Mass and Cass area is Andrew Station, which is right down the road from where I live. And I see the young men and women every morning getting off at Andrew and walking. So you see them every morning walking up Southampton Street, heading towards Mass and Cass early. 7 o'clock, 7:30. Even those people are living somewhere, but they're coming into Boston for whether it's services or for methadone, or it's to engage in the illegal drug trade. But my final comment is we still have to have hope. We just can't give up on the situation, and residents demand our full attention to hopefully solve this problem. But it is frustrating and disappointing when the public health professionals are not here answering questions. Just like elected officials, at times we don't want to answer questions, but we don't have a choice. That's our job. Sometimes the questions are difficult, but it was a mistake not being here today. I think public health probably realizes that now, but it's about working together. It's about treating each other with respect and dignity. Even though they're not here today, we still have to work with public health. Whether we like it or we don't, they are part of the solution. But not being here today is certainly disappointing. Thank you, Madam Chair.
Thank you. Councilor Mejia?
Thank you, Chair, and thank you. I'm going to start with apologies, because I think that you have come into this space with the expectation that you were going to be heard, and so at least we're here listening. So just want to say thank you, you all. I have been in deep reflective mode lately here in the city of Boston, and I have come to realize in my short period of time here in the world of politics is that everything is so politicized, and we have a city that is so divided on how we're going to get to where we're going to go, and everyone digs their heels on what they believe is the way to go about things, that we never really create space to say to up the other side, or whatever the case is, that I see you, that I hear you, that I'm willing to work alongside you to get to where we need to be, so that everybody feels like they have lost. We just don't know how to do that here in the city of Boston. And the people who lose the most are the people who we're here to support and fight for, right? And I just think that we have to really seize these type of situations to really rethink how we are moving, because I just don't think anyone is really meeting the mark or the moment. And I, having lost a cousin to a heroin overdose, having worked in this space in the early 90s when there was the crack and heroin epidemic, and I was working with women who were sex workers in orchard gardens, right? That was in the 90s. And we're still, decades later, having the same conversation, but it is at a very different climate. And so there is something to learn about history, and if we don't pause and become more reflective, we're going to repeat history here in the city of Boston, because I'm seeing a pattern on all issues that are politically charged and how we show up or don't show up for each other. And so I am not interested in feeding into that way of working, because we're supposed to be leaders. And what leaders do is create space for the people who are living these realities, like yourselves, alongside those who have decisions to make power, to come together and find solutions for everyone. And not everyone's going to be right, and that is okay. And I think that that is what's missing right now in the city of Boston, in particular to this case. It has been, I don't know how many years, a decade and a half maybe, that this issue has gone on, and has just gone on, and has just gone on. And I've only been in this position for 3.5 years. And I have seen how we got here, because nothing was done beforehand. And now we're expected to clean up that mess. And I think that if we're going to really clean up that mess, then accountability is important. I wholeheartedly agree with the accountability piece. But what I struggle with is this us versus them mentality, and not in my backyard mentality, and this versus that mentality. That's just not how we're going to meet this moment. And so we can sit here and utilize political theater to act like we really care about what's happening, or we can really do the work that the community wants us to do and make difficult decisions and be leaders in doing that, but doing it in a way that we're not leaving anyone behind. Because right now, that's what it feels like. And it is unfortunate that this is the state of the political climate that Boston is in mirrors the national political climate as it relates to getting anything done. It is that us versus them divisive politics that has put us here, and unless we're willing to come to terms with that, it's going to keep us here. So I would like to re-engage in a way that is really about solutions and not about pointing fingers just because it's the season for that. That's not helping the people who are out there literally dying. So that said, I think we have an opportunity, and I want to remain hopeful. Because one thing that we can't take away from people is hope. And if we continue to lead in a way that makes it feel like the world is coming down, then we're never going to get out of this space, because we can't think, because we're so busy thinking about the world coming down. So if we pause and say, the sky is not falling, let's take a deep breath here. Let's really evaluate what we need to do. What are the pros and cons? What's the game plan? And I'm looking at you all, but I'm hoping that they're listening, right? Just so you know. What's the game plan? How we're going to evaluate that game plan? What's the 3-month, 6-month mark plan, right? What are the metrics that we're going to utilize to hold ourselves accountable to it? That's the type of plan that I'd love to see. That's the type of leadership that I believe this moment requires. But this us versus them, pointing fingers, and who has it worse, is not going to help any of us. Not even here as colleagues, to be able to work together if we can't see each other. So I am not going to engage in political theater, even though I am an award-winning actress. I'm not going to do it, because you know what? People expect better from me. And if I have to show up in a way that's going to get us to where we need to be, where no one feels left out of the conversation, then I'm willing to do that, because Boston deserves that. Given our history here with busing, given the racial divide that exists in the city, given all of the drama and trauma that we have experienced here on the city council, now is the time for us to reflect, restore, and reevaluate how we're going to work together. And if we're going to utilize this moment to think about how we get there, then I'm here for it. But if it's going to be more of the same old, y'all can find other political pawns to join people's political bandwagons, but I'm not here for that. So I'm going to put that on the record, because I think it's really important. We're talking about people's lives here. This is not time to play politics. And that is what's happening here in the city of Boston. With everything that we have experienced, now is not the time to continue to work in this way. So if I can utilize my vulnerability to bring people into a different space, then I'm willing to do that work. And I think here's some things that I'd love to unpack. One is, when we talk about the work that you've been doing on the ministry, and I think that that's important, because, my colleague Frank Baker talked about spirituality, and that's hope, right? And I think that many of us have lost hope in everything, right? And so when that happens, what do? You turn to things that are going to cause you harm because you no longer want to be on this earth, right? Whatever the case is. I'd love to hear what your thoughts are of people's, because you can't legislate someone, you can't legislate preventing someone to violence. You can't legislate violence. You can't legislate anger. You can't legislate what people's personal choices are, right? What people choose to do, those are very personal things. So when you think about the situation that we find ourselves in, what feedback or recommendations do you have knowing that you can't legislate personal choice? How do we deal with that? Yes, please. Wait 1 second, because we want to make sure we can hear you.
We all have a free will, and you can't legislate choice. You know, these people I'm talking about out on the Atkinson Street, it's almost like they've lost their ability to have a free will because they're in the bondage and throes of addiction. And in my worldview, you know, I have a biblical worldview, there are demonic forces that have these people stuck in that. And it is so sad to see. It's really sad to see. Some of the things that I've heard, you know, if they do go and they take the tents down, I appreciate what this representative over here said, is that where do they go? Do they go into people's backyards? Where do they go? Where do they go? You know, so if given the choice, like I was out last winter at different times in the freezing cold, I'm bundled up. You see people with their jackets wide open. There's some of them without jackets. All they have is one mind because they're in that bondage to get that next fix. You know, you see people in their tent with a fire going inside the tent just to try to keep warm because they don't want to keep the rules if they're told to go into a shelter. You know, if they choose not to go into a shelter, that's where I would say arrest would come in. Give them a few one-nighters. Give them a one-nighter. Give them that list of one-nighters. And when you're in those situations, which I had several one-nighters, you think, where is my life going? What the heck? If you're just out there in the streets with the same old, shooting up, you're in that bondage. You're not thinking about taking steps for your life or taking that first step to recovery. You're not thinking about any of that. You're just totally staying wasted all the time, you know? Yeah. So you know, I'm not real familiar with Long Island. I know they blew up the bridge, and I don't know what the works went on out there. I heard Mr. Flynn say, what about a ferry service? But if I was to open up a place like that, I would make sure that there's an excellent program there and show the people, you know, this is the first step. I agree with that. Having a detox program, you're going to get clean. There's hope for you if you get clean, right? And then we're going to talk about maybe a training program, getting you a way to make a living, maybe housing, helping you to afford affordable housing. You know, show them the program that you come up with, that there is hope that you're talking about. Because right now there are a lot of people are hopeless and they just stay in that perpetual misery and pain. And but if I was running a program on something like Long Island where they come out there, I would say you're going to be subject to a search. Nobody gets on that island with drugs on them, right? And you're going to have a strict program there where you're going to get clean. And a lot of people that are hooked, they fear the sickness of getting clean. That's something that keeps them from getting clean, is the sickness of getting clean. They fear that. They fear that the agony they're going to go through, you know? And there are, I don't want to take all the time, but you know, there are people on the spiritual side of things. There are pastors, there are Christian people that have come through getting straightened out. A lot of people I know that volunteer their time, that would be willing to go into these places. You don't have to reinvent the wheel. There's things like Teen Challenge. Yeah. There's things like, I spoke at a Salvation Army last night, and at the end of it, they have a detox program there. It's a 6-month program. Somebody that was in the first AA meeting that I stepped into was there. I didn't recognize him. He had glasses. He had no hair at this point. He's shaving his head. And he came up and he said, it's really good to hear you. I remember when you first came in, you didn't talk. You were just... And I went through that period of just pain, you know? But He said it was really good to hear you. But there is hope. There is hope for everybody. There's no worst case scenario out there where somebody is hopeless. I believe in God, as I said. I believe Almighty God can help anybody. He loves everybody. And there's people willing to share that love and that care. And, you know, it's a sad condition that it's in. But, you know, there are, and I'll just mention again the status quo. I think there are people behind the scenes that I don't know how to follow the money trail, but there's people that are happy with the way things are, that are making money off the misery of other people.
Yes.
And you can start with the cartels bringing the fentanyl in from China, you know? Somebody's allowing that to happen.
That's right.
Somebody's making the money and there's people being paid off, but that's another whole subject. But
Listen, I appreciate that, because when you talk about following the money, you know, when we talk about accountability, there are a lot of doctors who are prescribing painkillers to folks and are doing so recklessly. I think that that's another part of the conversation. That's not what we're here to talk about today.
Yeah.
But when we're thinking about the whole picture, we have to really think about all of the players that are playing into the situation that we happen to find ourselves in. And not that I go around throwing a lot of compliments to anyone, but I know Neil would appreciate this, is that, you know, I think that the mayor really in good faith came into this, really trying to come into this work and trying to figure out how to meet the moment. And I think there's something to be said about her approach, right? And I think that, you know, we have to just be mindful, like we're just trying to explore all the different ways for us to handle this beast, because it is, I always say, how do you eat an elephant? One little piece at a time. It is a big undertaking. And I think that people get so caught up in their own stuff that they're unable to really kind of see all of the different moving pieces. And I just want to name that, you know, I really do appreciate the early stages and the efforts that were made to address this issue, whether people agreed with it or not. I think it was worth an effort, which is better than doing nothing, which is what we had been getting for like the last 10 or 12 years. So I want to uplift that. And I also want to uplift Sue and your innovative ways of how you engage people who are living out in the streets, who are really trying. I mean, like, we have tried everything. And I think it's important for people to recognize is that we are not the ones that are going to fix that problem. People have this belief, because we're the city council, that we are the ones that have to fix this problem, or that the city of Boston is responsible for fixing this problem. It's going to take every single legislator in the state of Massachusetts owning what their piece of the pie is and being accountable to it. It is a statewide issue that just so happens to be in the city of Boston. And until we hold all of those people accountable, right? Y'all keep thinking it's the city of Boston and the city council. Y'all haven't done this, y'all haven't done that, because there's just so much that we can do. Like, we approved the budget, we fought for the dollars that we were needing, that were needed, and right now, to the point of like, who's making the money? The Boston Public Health Commission. So then we transfer those dollars into the Boston Police Department, and we don't think that it's about money. There's money there to be made on both sides. And unless we start changing the conversation, it's going to go in the direction that it does not need to go in. And we need to center it on the people who are living the realities and or doing the work in those spaces. And that I have not heard anywhere yet. So that's what I'm invested in, is that conversation.
Sue, did you want to respond?
Thank you, Councilor, for your words, and you're absolutely right. We can't blame anyone. We can't move backwards. We have to move forward. And forgive me, I am incredibly passionate about this. It is now 8 minutes to 4, and I just feel like I'm someone who is on the street every single day, 5 days a week, okay? A couple hours a day, 3 hours a day. I have a team out there working. I feel very, very strongly, this is very personal, that what we're here today, and I appreciate all the councilors' discussions and all today. They were all, you know, they all brought up great points, all of which we know, okay? But, you know, it's hard now to be talking, half the councilors gone, half the cameras are gone, because it's now 10 minutes of 4. So forgive me if I'm a little frustrated, okay? That is if we're talking about whether this is a public health emergency, I don't know how there is anyone in the world who can look at what goes on down there and says it's not a public health crisis and a public safety crisis. Okay? When a counselor can't walk down there, when I can't walk down there and all without a feeling of needing something to make myself safe, okay? That's not okay. But we got to go forward from that. And it's what is the solution? And the solution is we do need a public health emergency. We need to declare a public emergency in order to get the things done that need to get done. We need a recovery campus. We don't need it 5 years from now. We need it now. The people who are on the street down there cannot live for another 4 or 5 years this way. We need to find the solutions now. This crisis is what led the community to come up with a plan over the last month and a half that we've brought out. And that plan, by the way, was not a new plan. It's basically what's supposed to happen on Long Island eventually in a microcosm. But it does what needs to get done. And by the way, you're absolutely right, Councilor. Mayor Wu came out and she has worked very hard. She made bold moves a year and a half ago. But we need the bold moves now. We need to actually, this crisis is not going to end until we remove the open air drug market. We need to stop the drugs on the street. We can get rid of tents, and by the way, I'm a full believer that we need to get rid of those tents, okay, because I've seen what goes on behind those tents. But what we need more than anything is to stop that open air drug trade. And if we have a recovery campus, and I can't remember which counselor mentioned it, but we can have a recovery campus, but we can't also have the party going on the streets. Everybody's got to do their part. Enforcement on the outside, recovery campus on the inside. We have to have a full accountability of everyone. And I guess what I look at when you talk about that we shouldn't be fighting against each other, I agree wholeheartedly. Everyone has to come together in order for something to get better. You know, there are people who have said that the plan that the community has come up with was not informed by public health officials and all. It absolutely was. It was informed by members of the city's administration, the state administration, and public health experts. Okay? That's what we need. We need everybody coming together. You know, I look at this and I go, how can we not think this is a public health emergency? You know, we thought this, and I have to say, probably one of the most ironic things to me is that I pulled out an article today from July 17th of 2017, when Newmarket and the South End Forum came together and petitioned Mayor Walsh for the long-term recovery campus that became Long Island. The concept for Long Island. And the things we were saying back then in this article are the same things we're saying today. Please, we need to all come together to create a full solution.
Thank you, Sue. I so appreciate that, and I think it's important. I've assumed the role of translator here. I grew up translating for everybody. And I feel like in so many ways, a lot of the people that follow me don't understand what's happening in the government space, so I have to translate, right? And I think that we have to keep going back to the basics. We have to learn how to work together. We have to learn how to legislate together. And we have to come to terms that not everyone's going to get what they want. And that's okay. As long as the people that we're there to serve, which are the residents who live in the area, the businesses that live in the area, the folks who are frequenting the area, all of those people need to be a part of the conversation. And I think what happens politically, right, is that people want to go to the spaces and places where they are celebrated and or embraced. And I feel like courage takes the form of you pushing yourself to show up in spaces and places where you may not be the appetite. But in those spaces where you learn the most. And I think that is where I'm at right now, is I really stretching myself to be in spaces and places where I normally don't operate in or I don't agree with because whatever, but that's not gonna get us to where we need to be, which is why I'm happy and encouraged with this whole idea of really working together across our differences, because we don't know how to do that. All we know how to do is tear each other apart. And that's on both sides, right? Both sides are winning their battles by themselves. Meanwhile, the residents, the businesses, and the folks who are freaking that area are losing. And I feel like, yes, bold changes are important, but those bold changes are not gonna come with just a whole bunch of blah, 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 which is what I feel like in the last 3.5 years that I've been in this position, is what I get a lot of from the administration, right? We just get a lot of talking in circles, and I think that you all are the ones that are losing because we have to work with what we have. And if what we have to work with is, declaring this or that, that's not enough. I just don't think that is enough to meet the moment. And the young man who lives in that area, I think you have a right to know what the plan is. Mm-hmm. It's our responsibility to make sure that you get that information. And so I think, now that you put it on the record, which I'm probably sure you have another time, but I think you deserve to know. And that's our job as the council. Our job is to work with our constituents, identify what the issues are, identify what the trends are, and then to write ordinances, laws that will help address that. But this particular situation is so much bigger than the 13 city councilors that sit here and try to legislate. So I just want to manage everyone's expectation there. Don't come thinking that we can do anything other than just fight and be your microphone on this issue, because we can just do so much. And y'all can get frustrated as much as you want, but at the end of the day, we do not have the power to solve mass incasts. And if you think we do, go back to your history books and learn about the 3 levels of government so that you can understand who really has the power, because it's not in this room and it's not even in the mayor's office. This is so much bigger than all of us. And until we get to that...
I disagree. I think the city government created this mess by the way that they fund Boston Public Health. That Boston Public Health, for every addict who's out there, gets more money. Every year they get more money because there's more addicts. It's like a bounty on the head of every... So they get all the addicts. So they make it very easy. I know we like to blame the other cities. We want to blame the other cities for not taking care of their addicts. But those people aren't coming here for services. They're coming here for drugs. I can't ask Methuen or Lowell or Lynn to open up their own open-air drug market. This is something Boston Public Health has created, and it's the funding that the city gives it. More funding, the more addicts. Instead of saying, we're going to give you funding for every person you get off drugs, they give you funding for everyone that they keep on drugs. Their incentives are to expand and perpetuate addiction. And that's the problem with the city. That's the problem with the Wu administration, the Waltz administration, Menino administration, and the people who sit in city council, not questioning the incentives that you've created.
No, I really do appreciate that perspective, and I think it's really important for those who are tuning in to hear that, because I think it's all part of the puzzle. And then I'm curious, if you don't mind, let's peel away the onion a little bit more, right? So that's who's making the money, but how are people ending up addicted to begin with? So can we talk a little bit about that piece? Where's that at?
There are people who are weak. There are people who have problems. There are people who go through trauma. Some of these people have been through trauma. There's always a number. I mean, I grew up in New England. I know lots of addicts. I know more alcoholics than anything. But there's always the alcoholics. You say, if I lived what they lived, I'd be drinking too, or I'd be put a needle in my arm. And there's other people you meet and you say, oh no, they didn't have any problems. They're just jerks. They're just people The same way that people take, awful risks, do stupid things, and a lot of the time one thing I am sure of, that if you have an open-air drug market, you create addicts. The country with the most addicts in the world is Iran. And Iran has the most addicts right across the street from Pakistan and Afghanistan, where they grow it. So everything's cheap and easy. If you make it cheap and easy, when people want it...
Just going to give us 1 minute, because we do have people waiting to give testimony on Zoom.
So I would love to just hear this. I don't want to take up all the space because I want to be respectful. But I'm curious, like, if we look, it's like the question that we get is, how did the gun get here? So if we're really looking at peeling away the layers, how did the drugs get into our streets? I'm just trying to think of just understanding all of it. Like, I think that in order for us to solve the problem, we have to see how all of these things are interconnected. That's what I'm trying to help my viewers who are following this, help us understand where are the levers of disruption. Where can we start? Like, I understand and I appreciate the Boston Public Health Commission because the enabling piece, but I'm curious, even before we get there, where can we peel this onion? Like, where do we go from there? What's the next lever of accountability?
And not to cut you off, but if the administration was here, because the people here, you're passionate about it, you have your opinions, your views, where you're living and your experiences, but the administration would be able to help answer those questions.
I would love to add.
We'll continue. And I do just want to...
Well, you were going to say something?
No, well, hold on. Wait 1 second, please, Sue. So if you're finished, are you finished?
Well, I wanted to, Sue, if you were going to say something, I would defer my time to you.
I was just going to say that, respectfully, Madam Chair, when we talk about layering the onion, it means everybody has to do their part. It needs enforcement and public health. George and I differ a bit on the public health thing. There are a lot of people in our Public Health Commission that are working very, very hard to try to solve the problem. It's a difference of opinion and how they go about it. Okay, and we can agree to disagree on that. But what I will tell you is that unless you have both, you have recovery and you have enforcement and you have accountability, none of it is going to get better. You have to have all. Yeah. And that's that layer of the onion.
Yeah. Thank you, Sue. Sorry. And I'll end, Madam Chair, with the whole understanding that if we're going to have a conversation, we have to have a full conversation. And that full conversation requires us to look at every little piece of the puzzle, because only then can we crack the Da Vinci Code on how to handle the situation. And I think, Madam Chair, that I'm more invested in a solution-focused conversation, which is why I'm trying to better understand all the different things that are at play to get us here. And George has some really great perspective in terms of the role that the Boston Public Health Commission has or has not played, right? And I think that it's important to get that on the record, and I appreciate you, George. And I think that people get scared of passion. And George, I don't know if you've been following me, but I'm very passionate about the things that I care about. And I appreciate that passion because passion is important. And I'm being told to...
So thank you,
silence myself, and I guess
I'll
leave.
Thank you, Councilor Mejia. We will have closing remarks, but I do just want to make sure that we have Steve Fox on Zoom, and we have maybe one or two people in the audience who do want to make a statement, and I do have a letter from Councilor Brian Worrell. First, I just want to make a quick statement. From hearing from my councilors who were here, I appreciate all of your input, all of your opinions, and staying through and sharing. I know you'll have an opportunity to speak again, absolutely. Recovery is hard. The path is never easy. It's bumpy, but I do know that if you're sleeping on the ground, under a tarp, next to trash, and next to drug dealers and people who are willing to take advantage of you, that your chances of finding recovery are close to none, if none. So we absolutely, and I do appreciate what Councilor Fernandez-Anderson said, something I've thought all along. is that the tents come down, but then what? That's just one small piece to the bigger problem here, that there's way more than just the tents, the tarps that are keep covering people down there. I mean, people are dying every day. We need to make decisions. And I do, as the chair, I will indulge 1 second to do say, I filed this hearing order and this resolution on Monday, September 11th at noon. The administration saw it. The agenda came out for the September 13th meeting. 15 days went by, and I heard nothing from anyone in intergovernmental. I checked in yesterday to see how the administration panel was, who was coming. I know that I had sent them off to central staff on our end in plenty of time so that these people who we invited, who I read earlier, are obviously busy people doing important jobs. But it wasn't until this morning, after it was leaked to the media yesterday, that I did receive the letter that the administration feels that this is unnecessary burden on the people we were hoping who would come to speak, because it will be the same as Thursday's hearing. I think myself and others made it very clear that it's two very different hearings. This is a hearing in the Public Health Commission. That's an ordinance in the Government Operation Committee. But that being said, I do want to read Councilor Worrell's letter. Let the councilors have one last chance, and then I'm going to have Steve Fox and I believe Clifton and John are in the audience, and if you still want to speak. But Councilor Worrell wrote, he's unfortunately unable to attend the hearing. My staff will be in attendance and I will review the video when it becomes available. I commend the sponsors for their dedication to addressing the critical issue at the intersection of Massachusetts Avenue and Melnea Boulevard. The ongoing humanitarian crisis in that area demands immediate attention and action. I will read his 4 questions. I assume that Councilor Worrell wasn't aware that the administration wasn't here, but I will read them so they're on the record. So I didn't want any of you to think these are questions for you to answer, this panel here, but I would like to pose the following questions to be addressed during the hearing. What specific measures and resources will be allocated to ensure the safety and well-being of individuals affected by the crisis, including those struggling with substance use disorder and mental health challenges? How will a declaration impact existing outreach efforts and support services for vulnerable populations in this area? What strategies will be employed to collaborate with neighboring municipalities and organizations to address the root causes of this crisis, which often transcend city borders? And lastly, he asks, can you provide details on the proposed timeline for implementing the comprehensive solutions to alleviate the humanitarian crisis effectively? I think that ties into your question, which I know everyone who answered here, we have not seen that plan, so hopefully this question on the record and yours on the record would help us also on the council get that answer. Thank you for your commitment to addressing this urgent matter, and he looks forward to reviewing the hearing, Councilor Brian Worrell. So I will go to Councilor Fernandez Anderson, Councilor Flynn, and then we can go to public testimony if you want to say.
Thank you, Madam Chair. I'll try to be brief because I do feel your sentiment, Sue, and I do apologize that the conversations do take too long, and we're all very passionate about it. I was really, just deeply impacted when Councilor Baker was talking about his family, and then, his brother, then his nephews, was it? And also, I know that Councilor Murphy has a very deep connection to this issue as well, in terms of family members, and I don't mean to speak for you, but I can only imagine what it's like for family members that are now counselors or advocates or people working on the ground who have a lot of experience in this field today, or whenever it seems as though that their time has been dismissed. So I do apologize on behalf of the council that the conversations have gone that way. With that, I just would like to make three points, and I think you probably had a statement to make at some point as well. But my point here was that, and I apologize, your name again? Brian. Thank you, Brian. I think the 3 points that I want to make is that, one, I do understand the divisive nature of politics. It's always us and them, right? So if advocates support you because you won your election by grassroots, then that's kind of like the direction you go. And if big funders and big deep pockets and, elite liberals support your campaign, then that's kind of the direction you go to. And then you see that very evidently and very clearly in politics, right? And then it becomes, and we're all somehow a part of it, because then you fall into a structure, a backdrop that was designed previous to you coming in, and now you have to conduct business or conduct your work based on the structure that is set out for you, i.e. Robert's rules. And so the structure itself, I think, for hearings and council meetings are not effective. They're counterintuitive. For example, what Sue mentioned, we talk for a while and we give out, and then we have like 5-10 minutes, and Councilor Murphy indulge us in time, but typically with everyone here, we would really only have about 8 minutes and then 5 minutes, and that doesn't help. And then community, who should be put forth first, rather, then have to wait and feel that they're not being heard, right? So that structure, I think, it's on us, the council, one, to research the work, the laws, the policies, to come prepared to meetings and hearings, and also to be looking at the structure so that we can hopefully fix it moving forward. And this gives me an idea in terms of council rules, in terms of attendance. I went through this during Ways and Means, where people would just not show up. And when they did show up, 2 or 3 or 4, they would go halftime, or Councilor Flynn being the exception. And yes, Councilor Murphy, those who are here, yeah, Councilor Murphy and Councilor Mejia being the exceptions. But I think that there should be some kind of rule, Council President Flynn, where we don't allow attendance to be recorded unless people can stay throughout the full duration. It is extremely disrespectful. And I understand it firsthand, being chair of the committee that held the most hearings. And so in terms of the Boston Public Health Commission, I think I'm Mr. Mr. George, and but also with administration. I do believe that under the guidance, or at least the plan of the strategic outlook, that the administration, Mayor Wu, has been consistent on her policy in terms of the tents or removals. When you look at the strategic outlook, it does give you a very comprehensive, level by level, where it does evolve eventually. So from short term to long term, the timeline, and in terms of what we're looking forward to. Example being that the consistency has been that it starts with services, two encampments or tents, and then eventually dismantling it, and then eventually removal. So I do see consistency overall with administration. And also when we look at research in terms of harm reduction, Boston Public Health Commission, and I deeply respect Dr. Jakutu, not because I'm political or because I have anything to gain here, but personally I do deeply respect her and feel that she's a highly competent woman who has, under best practices and research, have executed this plan beautifully. However, there is that component of what you mentioned, George, that the more you feed the beast, right, the more the beast needs it or wants it, or it's fed. So in terms of funding, and the more the need is there, it's like supply and demand. And so we get more money, and a city that gets more money is looked at or perceived as fiscally healthy or responsible. And so to get it or to exploit an issue that hurts so badly, even those viscerally impacted, it does lend to the conversation. What are we doing here? Are we actually the perpetrators, right? And so I agree with the more moderate approach, but I also know that so far the research that we have, the best practices that we have, even with looking at Lisbon, Portugal, and I still say that we have not truly compared the outlook, the strategic outlook, fully with Lisbon, Portugal's plan. It's not the same. And I've looked at Sue Sullivan's and Steve Fox and other folks in the South End community and other parts that have come together with an alternative plan for that campus that I strongly would like to go on record, I strongly agree with and support, so that it's more manageable. Then you look at the Shattuck plan, they're talking about, right, doing family housing plus this, adding beds, basically services to the Shattuck or redoing the Shattuck. And that, I think, poses issues, right? We don't, first of all, if you're going to do a whole bunch of numbers, just being more, it's not about quantity, it's about quality, right? It's not actually offering a holistic campus that is manageable, that is contained. And that is what your plan, or plan with you and collaborators, are proposing, right? And please remind me of the name again for...
Recover Boston.
Recover Boston. And so I think what's happening here is now the balance of the Mayor Wu, looking at fiscally what is responsible for Boston to do. If we're investing, or if we're looking to invest more with Long Island, then if that's where our money is going, then how are we going to now create this other plan that costs millions of dollars? Do we go after state, which I know that the initiatives are going toward that direction, to get funding, or how do we implement a plan in the interim to Long Island Bridge? The only reason why I talk on these issues, it's because I worked in behavioral health, because I worked with dual diagnosed clients, because I worked with chronically illness, and I was a HIV counselor for a very long time, 23 years in this behavioral health work, and that is the only reason why I speak in length. I definitely don't pretend to have the solutions, and in terms of us against them or whatever, I don't care about that. Look, we're gonna disagree, and we're going to have some disruption in our conversation. The question is, are we going to do it respectfully, and then will we do it in a way that will be patient to build continuity in our conversation? And I think that that's what's lacking in city government. As you can see, people leave early or they don't show up. So how is anybody supposed to take us seriously? We have a job, we have a responsibility. So if we say to the administration, hey, you didn't show up, but we don't show up in full, then what are we? We're hypocrites. And so I really feel that, let me slow myself down because then I'll ramble and I'll take up time and I'll do the opposite of what I said I was gonna do. I'm not gonna go into what I think the problem is or whatever. Everybody here is half expert, right? And we don't need to go in lengths about, there's addiction, there's mental health, and then there's chronic homelessness. We all understand that. And then there's the drug dealing. There's 4 components to this, not just the 3. Then there's the drug dealing. And I didn't want to speak to this too much, but my own personal experience working with Mass and Cass, I go to Mass and Cass a lot. I go with either mosque or churches to do programs or volunteer stuff. This day that my phone got taken, it was taken by someone I actually know. And so, contrary to the media, it just so happened that people are human, and it was an opportunity to sell a phone or whatever. And then someone else that I knew that liked me, right? Someone that lives there, took it back and brought it back, not the police, right? But the police was wonderful, they were professional, I appreciated it. The point is that, look, I really appreciate you all. I'm asking you to bear with us a little longer, continue the conversation. Come Thursday, let's have this discussion. I know, right? Let's continue this discussion. And please, I want to hear from you.
So the published time was 10 to 1 for this hearing. So this amounts to the 3rd rescheduling when, this has been moved to 2 o'clock, 2 to 4 now. And now it's being moved to Thursday. So as a member of the general public, it's very difficult to show up.
Just to be clear, this hearing will end when we gavel out. It is not being heard on Thursday. That's a completely different ordinance that the mayor wrote, a legal document that the council has to go through.
But
not this hearing at all.
Essentially, yes.
As a member of the public, it's just a distinction without a difference.
Yeah, well, it's and I think the administration with the last minute letter stating that they won't be attending, and then colleagues choosing sides of who they'll, and instead, is making it more confusing for the public.
Yeah, and it's hard to give constructive feedback. We're all trying to address this issue as best we can, and it's a complicated issue that it hasn't solved itself with a lot of effort and a lot of money and a lot of time. In one of the smartest cities in the entire world, we haven't been able to take care of this issue. So it's going to require us putting everybody in a room and working our way through these issues, or it's never going to get to a viable solution. Some issues have been brought up as you just on the ground. I've seen the answer to. What about the drug dealers? I see them making drug drops on Harrison Ave at night, dropping packets behind potted plants, and someone else comes and picks it up and then migrates it to Mass and Cass. Like, that's the kind of information, like, if the police were here, I could share that feedback on how to catch this behavior. You're making an ordinance that tents are going to be removed, and if you limit the definition to tents, you'll notice that on Mass and Albany and Harrison, people are starting to use umbrellas. So they'll form very large umbrellas, and they'll form it into a tent to escape the definition. So things evolve as we take action. So it's one of those things, you need people meeting weekly to share this kind of intelligence between the city government and the people on the ground that are witness to this. And you can make better and more informed decisions when you have that kind of information. A plan was put out with a 60-day clock on it, with no notice to the abutters and no formal notice to the neighborhood and very little time to react here, and it's been rescheduled 3 times. So my comments are just we need a lot of transparency here and a lot of eyes on it in order to reach an informed decision that actually helps people. If these things are done behind closed doors, how do you help everyone?
Thank you.
May I
Appreciate
respond?
that. Yes.
Thank you, Madam Chair. Thank you, Brian. I don't know if you're a constituent. I would like to get to know you if you're a constituent. Not removing the responsibility for myself. My office would love to do a better job.
Yeah,
with
I
that.
stopped by your office and no one was there to speak with me on Friday. You would email me and ask me to speak with, I believe it was Shiza, and I emailed her a couple times and could never get on the calendar, so I came in person. And when that didn't work, I went into the mayor's office, and I only got the same thing that's been sent to the city council. I went down to 1010 Mass Ave, and no one was at the records room, so I had to email the press person to get what I got. I just, I just want to know what was going on, and I
Brian,
can't get an answer. You mentioned that the mayor has a plan and a long-term strategy. Like, show us. We can give you feedback. We can help. People want to help the situation. We can't do that if we can't comment on what the plan is.
One question at a time. My office does close for just summertime until, well, we're past summer, but until December. We do close on Fridays because we're doing civic engagement on Saturdays.
Okay.
And so, not to overwork my staff, I am the one who answers the phone on Fridays to cover my staff. And so if you called, I apologize.
I came in person. I physically came and I
forward-
asked the secretary at the city council's office, is anyone at your office, or is Shiza there? And they said no one is in at all.
You are frustrated.
Yeah.
And as whether you're a constituent or not, I take you seriously. And you came to my office and it was closed, but I forward my calls on Fridays because, again, I alleviate my staff on Fridays. And so this is just temporarily for a couple of months. And so we can do this project. What I was saying to you in terms of community engagement or outreach, it is on the Office of Community Engagement to report to abutters, to announce anything that's happening. However, I am taking responsibility and saying it's something that I can do extra to think about in terms of ordinances. We do post it on social media or sometimes email. And then if we're not doing that, there's a challenge, right, with digital equity in terms of, okay, what if I don't have access? So I'm thinking through those policies. But today, I think the conversation is not about me and my office hours and you having to be frustrated. But I wanted to acknowledge that and say it is my responsibility, and I will always accept the responsibility because we haven't gotten to know each other, but maybe one day hopefully you'll allow me the chance to build trust with you. Moving forward in terms of reaching out to abutters, I can look at the mayor's office again. I can only give it to you when I have it.
Well, it's already approved, so it's too late. Permit's approved.
The permit.
The permit is already approved. It's been signed off by Sean Linden.
We're up to 80.
Where you were supposed to go, yes. But I'm saying to you, moving forward, You're not going to need anything else from me? I would like
It's just, we're trying to help a challenging situation and don't even know what the facts are of what the plan is.
I was speaking to the strategic outlook. It's online, but I can give you the information. It was also, I think you were in a meeting, now hearing what you're saying, I think you were in the meeting where Dr. Jakutu spoke about it.
Yeah, I got invited after I noticed in the news what was going on and was just trying to gather more information.
Mm-hmm. And so that meeting was not from my office. It was from the administration. The administration is responsible for their own meetings. But I am saying to you that when you mentioned the long-term plan, that I mentioned long-term plan, I was specifically saying that there was consistency in the strategic outlook. But it sounds like, if I may, it sounds like you're just frustrated and dissatisfied so far with the service, right? So, give me a moment, because I allowed you. This is not the platform for us to go back and forth. If you disagreed with the strategic plan or whether or not the administration has been consistent, that I respect your position. And if we can continue the hearing, as you said, the public, the testimonies that we need to take from whether it is Zoom or people in person, that would be great. But let's connect after the hearing.
Sounds like a plan.
And let's fix it. Thank you.
Thank you, Councilor. Ethan, could we get Steve Fox, if he's still here, on Zoom, please? Thank you. Hi, Steve. If you're there, you can... We can't hear you yet.
There we go.
Here we go.
Sorry.
We can hear you. Thank you. Thank you for your patience.
Thank you, Councilor. Really appreciate the opportunity to speak. I apologize for not being there in person, but circumstances being what they were, I couldn't be there. But I did want to be very short in my commentary. I want to pick up where Councilor Anderson and Brian just ended. I think, Brian, you were a participant in the working group on addiction recovery and homelessness that we just held this past month. And that was the meeting that the councilor was referring to with Dr. Ojikutu, where we began to discuss a bunch of issues associated with the city plan. I have to say that I tend to agree with you that we don't have what we would hope for is a really full briefing on what that plan is going to look like. If you'll recall, one of the things that we talked about was the enforcement plan, and the deputy superintendent from the Boston Police Department there tried to answer multiple questions from the community about what the police were actually going to do if in fact they came upon somebody who was shooting up on the sidewalk, and we really couldn't get an answer. So I'm hopeful that that at the meeting on Thursday, where the ordinance is actually under full consideration by the council, that we'll be able to get very specific answers to questions that we couldn't get in the working group meeting this month. So let me confine what I want to talk about to two things. One is that I think it's really important that we not repeat the mistakes we've made in the past. And while I think it's important, as Councilor Mejia said, that we begin to understand that this is a global issue and that there are many layers to this onion, I think that for us in this community, and for me personally, and for Sue Sullivan, my colleague, and for George, and certainly for Brian, that we really have been dealing with this on a day-to-day basis, in my case for 10 years, And I never imagined that 10 years later we'd still be having the same discussions over and over again. This is like Groundhog Day. And we need to understand that we've been having these conversations repeatedly through various administrations, and we keep hearing the same solutions without new proposals. When Sue and I did the press conference and announced Recover Boston in August, we offered an actual opportunity for the city to embrace a new proposal, something that was both a front end and a back end approach to the crisis at Mass and Cass. The ordinance approaches this issue from a strictly front end viewpoint. And I'm hopeful that as we come out of this hearing and as we move to the Thursday hearing, that we'll understand the importance of having a back end that is beyond just removing the tents and displacing hundreds of people and expecting the police and outreach workers to manage a population that is then widely dispersed. That we will begin to understand why Recover Boston represents our best hope, in that it provides a bridge to Long Island, a bridge to a recovery option. I'm cognizant of what Councilor Flaherty and Councilor Flynn and Councilor Baker have all said about the importance of treatment, and that's what Recover Boston is designed to do. Once the tents come down, the population in need, the most vulnerable people at Mass and Cass, need to have a place that they can move to other than under the BMC bridge or into our parks, playgrounds, and alleyways, or into our streets elsewhere in the South End, Roxbury, and other parts of Boston. And so the ordinance needs to be viewed in terms of how it will actually impact our neighborhoods. And I'm hopeful that the council will really be cognizant of the fact that we've been here before. We've talked about clean sweep under the Marty Walsh administration. We've talked about this over and over again. And what I'm hopeful for is that we won't simply repeat the same mistakes we've made in the past. So, like Councilor Mejia, I'm hopeful that we will turn the page and we will find an approach that makes sense. The ordinance, as it is currently constructed, puts new facilities into the South End community on Mass Ave, where we're already seeing people, as Brian is experiencing, we're already seeing people migrate to this location. And we're already seeing new efforts to create new encampments in this area. And that's not the right way to approach this. So I'm really asking this council, and I'm asking every member of our community to really be cognizant of the fact that we've made mistakes in the past. Even the mayor was willing to say that the original removal of the tents and the creation of the roundhouse had not done the job. It failed. And this community told everyone who was willing to listen that opening the roundhouse in the middle of a drug open air market was doomed to failure. And so it is. We're saying the same thing about opening a new facility on Mass Ave under the BMC bridge. And we're hopeful that people will listen to that and will find alternatives. We as a community have proposed those alternatives. And so we look forward to working with everyone, and we're hopeful that we'll actually find real solutions. We've been doing this for 10 years. It's time to fish or cut bait.
Thank you. We have two people who signed up for public testimony. John Provenzano, did you just sign in or do you want testimony?
Yeah, I'll talk.
Are you sure? You don't have to. I just have your name here on the list. You may not have circled yes to speak. But Clifton, you did sign up for public testimony also.
My garage fee is going up by the hour. John Provenzano, South Boston. I'm a resident of the city of Boston, which I love. First of all, to Councilor Murphy, this meeting was a success. Even though the cowards didn't show up that should be sitting here, I'll talk from the street. They were cowards not to be here. This meeting was a success. And Thursday, I hope there will be more success in moving on to what we should be doing. I personally have family members that worked over on the island, Long Island, and I could give you a list of the people that they helped over the years. Actual list of people that they were helped. And there was a sign, there was a big sign on that building that my nephew helped put up. And when it took the people off the streets and brought them over there, the sign said, "Welcome home. Welcome home," because they were going to get help, and they did. And what's going on the street now is a failure. I want to thank the councilors for being here. Councilor Mejia, I respect what your views were and what you talk about politics. Politics there's a certain amount of crap that comes out of the politics, and I understand that. But if you're dealing with the heart, with your heart, things will get better. The three gentlemen that spoke here, I know all personally. I watched two of them grow up. And they talk from the street. They talk reality and what has to happen. What I would like us to do, if we could, Councilor Murphy, maybe it's far-fetched. I don't know. I'm just a resident. I'm not no big educated person. But I'll tell you what my father said a long time ago, and he worked in a factory since he was 14 years old. When I asked him to send me to college, he was embarrassed when he said he couldn't do it. And I said, "That's all right, Dad." And he said to me one thing: it's one thing to be educated, and it's a lot more important to be smart. And if we all get together, if every councilor got 50 people next week, 50 people from every councilor, and we went up to the State House and we let them know what we want to happen, it'll happen a lot faster. Every one of us, every councilor, do the numbers, 50 people, and I'll be there with you, and I'll have my whole family there. I'll have my great-grandchildren with me there, because I don't want them to fall into the stuff that we've seen happen. It's heartbreaking. I had a bunch of notes, and I'm not going to go through them, Councilor, but I'm going to give you a couple of things. I had on my union office a saying, and I was elected for a bunch of years, and in all the offices, I gave one to each of them. And all it said was, if the people will lead, the leaders will follow. And that's how you get things done. I respect this body. I've been coming to this body since Ionella was here, and it wasn't named the Ionella. That what?
So young. You're so young.
Oh yeah, thank you. Who's my undertaker? But that was one of the sayings that I believed in, and I'm sorry, I'm not a good politician as far as speaking, but the other little thing I'd like to say is debate leads to compromise. And if we debate, not shut each other up, will lead to a compromise. I want to thank you people for sitting here. You're a lot more interesting to listen to than what I would probably have listened to with some of the leaders. And I don't mean to offend anybody. I just know that's where it comes from. It comes from the people that get things squared away. You don't need the cameras, television cameras. You speak from the heart. Thank you very much, Julia. Councilor Mejia. Thank you to the gentleman that spoke and showed the reality of what happens with all those needles and everything else that we baby. These people are human beings. They need to be loved. They need to be taken care of. And like I said, at the building over at Long Island, my family there's a big sign, "Welcome home." And so many people left there healthy and became good citizens, just like this gentleman that had the problem. And I've had them in my family. We've all been touched by them. So thank you for the meeting, because I know I could
Thank
go
you.
on, but
Thank you.
this was a success.
I agree.
And I
Every
appreciate
meeting
it.
You show up, things happen. Clifton, you're,
I promise to be real short. Clifton A. Braithwaite, community activist for 3 decades. And I'd like to thank the council for putting this on, and the people that are in the trenches that are here. And a special shout out to Chair Aaron Murphy and Tanya for doing the email blast. And I did the best I could to give the community an update, but I'll push real hard for Thursday. I just wanted to say, I'm gonna start off with 4 neighborhoods: Roxbury, South End, Charlestown, and South Boston. We've all been led astray. Now, a lot of people in my community on the black side faced a lot of criminal charges and went to jail. But the 3 different communities that I mentioned, South End, Charlestown, and South Boston, went through the same ordeals quietly. This is about the 99% to the 1% that can get the actual help with their drug addiction. I have friends all over the city, and my friends from South Boston said, as time went along, I know what it is to be from the Roxbury community, because as time went along, they realized that they were lied to. We can look in Charlestown when they were bank robbers. That just wasn't alcohol. That was dope driven, right? Now, in all those neighborhoods that I mentioned, they're dealing with being moved out of their neighborhood, and we're not sticking together. This is this is about the people. And I'm confident that we can head in the right direction, but we need, someone mentioned the people power. We definitely need the people power to back up the council, to push the state legislation, and to push on the federal end. But if we keep pointing the fingers and keep thinking this is an isolated problem, I'm gonna go right back to my opening. The 99% that are affected are controlled by the 1% that make all the decisions in our city and in our state. I've seen Boston come a long way, and I hope I'm at the forefront to put a little footprint in the sand to make change in our community across the board. We can do this if we collectively come together. But if we do not sit at that table and buckle down and really put in the hours like we had to when COVID kicked in and everybody didn't know what was going on, and stop blaming, we will change the rest of the country. And I truly believe that. We've come a long, long, long way. So I ask this body, I'm 100% behind everybody, but we need to push the message further, and we gotta stop looking for outside groups to make a decision here in Boston. And when it comes to the different parts of town that are sending their disenfranchised men and women to our community, I'll say it again. Once we identify who they are, those towns should be responsible for paying some of the bill. They should be helping us with land. So without taking any further, because we've been here all day, I just want to say whatever it takes, whatever measures we have to do, the bottom line is we have to come together as humans, because this is a human crisis. God bless the Commonwealth of Massachusetts and the Boston residents that make things happen. My name's Clifton A. Braithwaite. Thank you.
thank you, Clifton. Before I close out, I wanted to see, Councilor Mejia, did you have anything to close out with before we?
Go ahead, you can take my time.
No, I apologize. I have to go.
We all have to go, yeah. And
I have-
thank you. Thank you.
I apologize.
Sue.
Thank you,
Thank
Brian.
you
No,
all.
you're fine. You've stayed longer than
Thank you.
expected. Thank you.
Thank you, I really appreciate it.
Yeah, no, go ahead because you can watch this later, but there was a guy that was here, he left really upset that we did not really listen to you. He said that he's been in the trenches with you for a long time and he was frustrated. And I think we all are frustrated. And so he was your biggest fan. And we just want to thank you for your work. It is not
Thank you all for being here and
unseen.
for really, really making the time to tackle this. And I really did appreciate every counselor's thoughts and everything, because the more we talk about it, the more we get something done. So thank you, really.
Thank you.
Safe
Appreciate
travels.
it.
So I'm not going to hog up too much space other than to thank you, Councilor Murphy. These are the difficult conversations that we need to have here in the city of Boston. And sometimes we rather not have the real conversations and we rather just deflect. And so I really do appreciate the panel. I appreciate you all being here and showing up. I think that there's still a lot of work left to do, and I'm here for it as long as I stay here. And even when I'm not here, y'all, I'm still going to be here fighting the good fight, just so everybody knows I'm not going away. Ha, 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 ha.
Thank you, Councilor Mejia. I'll just close by thanking the panelists who did come, the community members. This was an important opportunity for the public to hear from the Boston Public Health Commission and the other administration officials that were invited. The public deserves answers. You've made it very clear on some really concrete things that you're asking for, that you should have access to answers to. So, and I believe that the council, we deserve to be part of the conversation. We deserve to be at the table. They do have weekly meetings with the street team and everyone involved. I'm not invited to those either, but maybe we could find out when they are, and maybe they do let some public attend. So they do check in weekly, but the information isn't given to us, or at least to me, as freely or as often as I would like, because I think it's the information we need, the public and us need to have the facts to help make those decisions, these important decisions going forward. I do want to thank the councilors who came. I know that Councilor Flynn also deferred his closing remarks, but I wanted to just say that we will keep docket 1447 and 1450 in committee, because this is an ongoing conversation, but this hearing is adjourned. Thank you.